Good evening and thank you for keeping it TV47. You are just in time for Body Garage with I, Sheila Chelangat. And on this episode, still in line with the World Kidney Day, we are focusing on chronic kidney disease. Hi, Dr.
Hello.
And still taking us through it is Dr. Hussein Bagha. Dr. Let's begin with, is it chronic disease or is it chronic kidney failure? Which is which?
The technical term is chronic kidney disease because chronic kidney disease has several stages. So before the kidney fails totally, it undergoes through stage 1 to 5. Before it is termed as end stage or kidney failure in layman's terms.
So Dr. for starters, what is chronic kidney disease?
So if you look at the definition of chronic kidney disease, you need to have either a structural problem or a functional problem of the kidneys that has to be present for at least 3 months with implications for health. So if you look at it, there are two components to it. There's either a structural problem or a functional component to it. So the kidney function, it is normally assessed using a blood test. And what we normally look at is your serum creatinine, which is a chemical that we measure in the blood, and through which we calculate your glomerular filtration rate, or in layman's terms, what percent is your kidney functioning at. And if you look at the structural problems, you can look at is basically if you have, let's say, one kidney, or you have cysts in the kidney, or when you do a kidney biopsy, we get some structural problems within the kidney, or we do a urine test and we find proteins in the urine, which is persistent. So that basically will give you the definition or diagnosis of chronic kidney disease.
And you mentioned that you would need 3 months for the symptoms to manifest that one has chronic kidney disease. Does this mean that the symptoms are vague?
Yes.
And so with that, is it safe to say that the chronic kidney disease is a silent killer?
Chronic kidney disease, unfortunately, we pick it up much later, at later stages, because of the fact that the symptoms are quite vague, as I mentioned in the previous episode. And by the time that the patient is really becoming symptomatic and showing signs of chronic kidney disease, it is a bit late. And as you said, yes, it should be classified as one of the silent killers like hypertension or high blood pressure and diabetes.
Okay, Dr. And how common is the chronic kidney disease?
Chronic kidney disease is quite common. Worldwide, we have a prevalence of 850 million people living with chronic kidney disease. In Kenya, 10% of our population has some form of chronic kidney disease, out of which almost 500,000 require some form of treatment or follow-up, and out of which around 20 to 30,000 require therapy for end-stage kidney disease, which is dialysis or kidney transplant vessels, and they tend to damage your blood vessels. So this tends to reduce the amount of blood flows through your organs, including the kidneys as well. The high levels of blood sugars also tends to cause what is called an inflammatory milieu within the body, which also damages the kidneys. So in a nutshell, that's how the diabetes causes kidney disease. High blood pressure, and I always give this example to all my patients, assuming that you have a pump that is pumping water through a pipe at very high force. So the inner lining of the pipe gets damaged over time. And what happens is it becomes thinner and thinner. And that damage to the pipe, to the inner lining, it's the same situation that also happens within the kidney itself as well. So the very small blood vessels within the kidney tend to get damaged. And subsequently, it gets blocked as well, and it leads to scarring within the kidney because of lack of blood supply. So that's the way how both high blood pressure or hypertension and diabetes causes chronic kidney disease.
The chronic kidney disease is all about the kidney. Could you mention to us some of the functions of the kidney?
Yes, so if you have a family history of chronic kidney disease, because some of the things that cause chronic kidney disease are genetic, like polycystic kidney disease, then you are at a higher risk of developing chronic kidney disease. So, and that's why the family history becomes very important.
And can my family history increase the risk of me getting chronic kidney disease?
Well, initially it was thought to be of the older people, but now we know that it can cut across the ages. So there's another cause of kidney disease, which I've not mentioned, is called glomerulonephritis, which is an inflammation within the kidney itself. Anybody can get it, from the very young to the elderly. And a lot of times, as I mentioned, because there are no symptoms, people can be walking around with it, and by the time it is picked up, it is a bit too late. So they already have chronic kidney disease. Of course, the elderly, because of, especially males, because of the issues with the prostate and prostate enlargement, and if it's not picked up, the prostate enlargement causes obstruction, and this can cause chronic kidney disease. Patients with diabetes and high blood pressure, especially type 1 diabetics, we know that type 1 diabetes is a disease of the younger people. If it's not well controlled, can contribute to kidney disease. So as I said, it cuts across the age groups. Yeah, it's not that it's only the elderly or the very young or the middle-aged. It basically is across the age groups.
Well, you mentioned that sometimes the symptoms are vague. Could you perhaps tell us some of the symptoms that manifest before you make the diagnosis?
Commonly, you'll feel very tired because of the toxins building up. You lose your appetite. You have a lot of nausea because of the increased acidity that develops as well. Some people also start having a lot of vomiting as well. The legs tend to get swollen. Your urine output tends to reduce as well. And then you get difficulty in breathing as it now progresses to the advanced stages, because the water tends to build up in the body, especially in the lungs.
You said that it's from stage 1 to 5. So for each stage, Dr. could you tell us what it looks like in terms of the kidney function?
So normally there are 5 stages. So there's stage 1 to stage 5. Stage 5, of course, is end-stage kidney disease, whereby now you do require treatment, especially at the dialysis or a kidney transplant.
I heard you mention the glomerular filtration rate. What is it and what does it mean?
So again, as I mentioned in the previous episodes, we do have medications right now that help to reduce the progression of chronic kidney disease. So we do start the patients on those medications if they qualify for those medications. We have to treat the complications of the chronic kidney disease. Remember, the kidney is very important in terms of regulating your electrolytes, your calcium, magnesium, phosphates, potassiums. It is important in maintaining your blood levels as well and maintaining your acid levels as well. So as a kidney disease progresses, all of those tend to get deranged, and we have to correct all of those. And then, of course, we have to treat the cause of the chronic kidney disease. So if it's diabetes, we have to control the blood sugars. If it's high blood pressure, we have to control the blood pressures. And all of that help to reduce the progression of chronic kidney disease.
You said that it's from stage 1 to 5. So for each stage, Dr. could you tell us what it looks like in terms of the kidney function?
So of course, as I mentioned earlier, that when you look at the definition of chronic kidney disease, you're looking at the structure and function of the chronic kidney disease. So if you look at the stages of chronic kidney disease, we're basically looking at both the structure and the function. So when you're so structurally, I mean, you can look at so there are 2 things we look at. One is your estimated glomerular filtration rate, which we calculate using the chemical called creatinine in the body. So this was primarily what was used. So as your glomerular filtration rate or your percentage of kidney function declines, it means that your stage is worse. But now we're also looking at proteins in the urine, which is now been added recently in the past 15 years, that we need to look at proteins together with the percentage or the glomerular filtration rate. Yeah.
I heard you mention the glomerular filtration rate. What is it and what does it mean?
So it basically tells you how well your kidney is functioning in terms of its processes of filtering. So we use the chemical called creatinine, and we have formula which we use now to calculate it. So if your level of creatinine in the blood is very high, it means that your kidney is not filtering that out.
Yes.
So we use it as a surrogate, and that tells us at what level your kidney is at. Yeah.
So there's some mathematics
Yes.
involved in it.
Yes, it is. And I mean, it's not so complex, and there are formulas that are available online which anybody can access, and they're all for free.
You said that it's from stage 1 to 5. So for each stage, Daktari, could you tell us what it looks like in terms of the kidney function?
Yeah, so as I mentioned earlier that we do now have medications that have been shown to positively slow down the progression of the kidney disease. That is one. Number two, of course, you have to look at the causes. As I mentioned, diabetes and high blood pressure is the most common cause. So by controlling your blood sugars and by controlling your blood pressures, you can slow down the progression. Correcting all the complications, your electrolyte complications, your acid-base complications, you can slow down the progression of kidney disease. Eating healthy. Diet is very, very important when it comes to slowing down the progression of chronic kidney disease. Exercise, another very important thing as well. Very important. Avoiding over-the-counter medications. Some people have chronic kidney disease, yet they go to a pharmacy and buy painkillers over the counter. You are worsening your kidney disease by doing that. Please don't take any medications without your doctor's orders if you have chronic kidney disease. Don't take any herbal medicines as well. Herbal medicines also cause chronic kidney disease. They cause kidney injury, which can become chronic if it's not treated. So once when you develop chronic kidney disease, it's normally not reversible. It's rarely reversible. So the main aim now is to slow down the progression to end stage, which is why we always want to advocate to protect our kidneys, to prevent somebody from developing chronic kidney disease.
All right, Daktari, and with that, we are up for our first commercial break. When we will be back, we'll get to hear from him some of the treatment options available. Do not go too far, keep it TV 47, but first, take a look at some of the myths and facts of the day.
You will know if you have kidney disease. Unfortunately, most people who have kidney disease do not know it because in the early stages of kidney disease, most people do not have any symptoms. Symptoms may not appear until kidney disease is in the advanced stages. Testing for kidney disease is a long and costly process. Testing for kidney disease is easy. It can be done during a routine visit to your healthcare provider. Testing for kidney disease is easy. It can be done during a routine visit to your healthcare provider. It can be tested by a urine test to check for protein in your urine. Having some amount of protein in your urine can be a sign of kidney disease. A blood test can also be done to estimate the glomerular filtration rate. If you are at risk for kidney disease, there is nothing you can do about it. Not everyone who is at risk will get kidney disease. You can help protect your kidneys. Eat healthy, get regular exercise, control blood pressure and blood sugar, keep a healthy weight, quit smoking and don't overuse pain medications.